Intestinal polyps. Intestinal polyps are small, raised growths that appear on the inner lining of your intestine. They range in size from the tip of a pen to several centimeters. Here's what you need to know about them. Causes of intestinal polyps. Age. Polyps are more common in people over 50 years. Inherited genes. Some genetic conditions can increase the risk of developing polyps. Diet. A diet high in fat and low in fiber may increase the risk of polyps. Types of intestinal polyps. Adenomatous polyps. Most common type of polyps that can become cancerous over time. Hyperplastic polyps. Small and normally not cancerous. Inflammatory polyps. Caused by inflammation and usually found in people with inflammatory bowel disease. Symptoms of intestinal polyps. Bleeding. Dark, black or bloody stools, blood in the toilet, or bleeding after a bowel movement. Colon obstruction. Large polyps can block your colon and cause abdominal pain, bloating, or nausea. Diarrhea. Frequent watery stools that persist for several days or more. Iron deficiency anemia. When there's long-term bleeding from one or more polyps, it can lead to a lack of red blood cells and anemia. Diagnosis of intestinal polyps. Colonoscopy. A flexible tube with a camera is inserted into your rectum to look for polyps. Sigmoidoscopy. A shorter tube is used to examine only the lower part of the colon. Double contrast barium enema. An X-ray test to detect polyps by injecting air to expand your colon and filling it with contrast material. Quart colonography. A quart scan produces three-dimensional images of the colon. Treatment options for intestinal polyps. Polypectomy. During a colonoscopy, your doctor can remove polyps with a wire loop or other instruments. Surgery. If polyps are large, too many, or cancerous, surgery may be needed to remove part of your colon. Follow-up exams. Your doctor may recommend a repeat colonoscopy every few years, depending on the type and size of polyps. Complications of intestinal polyps. Colon cancer. Polyps can develop into cancer over time. Bleeding. Large polyps can bleed and cause you to become anemic. Intestinal obstruction. Large polyps can cause a bowel obstruction, which requires immediate medical attention. Anxiety. Worrying about the possibility of a severe illness can be a source of stress and anxiety. Prevention of intestinal polyps. Diet. Eating a diet rich in fruits, vegetables, and whole grains. Physical activity. Regular exercise can reduce the risk of polyps and colon cancer. Quit smoking. Smoking increases the risk of polyps and colon cancer. Thank you for watching. Please like, share, and subscribe.